Hello YouTube, welcome back to my channel. First off, I would like to say thank you to all the girls, just people that viewed my last video, shared, subscribed, liked. Thank you. It's very appreciated. Also, to all of the newcomers who don't know, this is a YouTube video about my experience in the DR. Basically, I'm just letting people know what to expect. Like, you're basically going through everything that I'm going through. So the first one was a video about me picking my doctor, me researching, quotes, just basically, everything there is to know about the whole getting started process, how hard it is to find doctors. Well, yeah, so you can find all of that out in my first video. It's part one. So part two today is going to be about vitamins. Your doctor tells you for pre-op you need to take such and such vitamins for so long, and then stop taking some for a couple weeks before surgery. So yeah, we'll also talk about recovery house, just how I'm feeling as far as with my process of right now. So first, vitamins. I started taking vitamins October 19th, and my surgery is January 16th. So I'm basically taking them a little more than 2 months. About 3 months before my surgery. So that's only because that was what I preferred. I mean, you can take them when you prefer. I had got my blood work done and everything before I started taking my vitamins, and it was a good level. I just want them high because I'm going to get a mommy makeover, and I know they're like, oh, you need a 13, you need a 14, and my Ebola was a 12.7, which is good, but I just wanted to be, there. So I had started taking them right after I got my first labs back. So, yeah. So one of the things that my doctor told me, which is, by the way, my doctor is Dr. Marcos Soto. Sorry, I can never pronounce his last name. I just call him Dr. Marcos. My gym, my hidden gym. That's what I call him. But, yeah. One of the things was this one. Folic acid was one. It is 400 milligrams. I only take it once a day, preferably in the morning. So it's like important B vitamin for women. It says childbearing ages. So yeah, that was one that I took. My doctor told me to get. Another one was, which is kind of like the iron. I took iron pills. I took my iron pills twice a day. One pill twice a day. Because I just feel like it's very important. That's like one of the main things in your hemoglobin levels is iron. So 65 milligrams. I take mine twice a day. So, yeah. That's another thing that the doctor said. And then the name, Nature Made, I actually just picked that one. It was just something that stuck out to me. You can have any type of vitamins. They all do the same thing as far as, like, the brand. I don't know. That one just stuck out to me a lot, so I just picked them, I guess. No real reason. Another one was vitamin C. Now, vitamin C, I take this one once a day, but for 2 pills once a day, because these are only the 500 milligram, and I take 1,000 milligrams a day. That's what my doctor had told me, or like, nah, they send a paper saying, yeah, these are pre-op meds that you should be taking, and it says 1,000. So I end up getting the 500 milligrams. I took 2 to make it 1,000 milligrams. Yeah, so not really nothing major. It's for the immune system. Builds up your immune system. Like, all these vitamins are actually good whether you're getting surgery or not getting surgery. It's always good to have vitamins. I mean, it boosts your energy. I cannot tell you, since I started taking my vitamins, that it hasn't been exciting to know that I get at least a little bit of energy, or to feel like, oh, these are going to help me get a lot more energy. I don't know. But yeah, that's one thing. Another thing was the multivitamin, the supplement. So I ended up getting these. These really stuck out to me. And I order all of my vitamins from Amazon. And this one actually stuck out to me. It was gummies. I'm like, okay, ooh, these might be good. You know, I'm already taking these many pills. Maybe I could just chew this one. So this one came in gummy form. And I actually prefer the gummies. Like, it actually works for me. I can just throw this in my mouth, chew it, and boom, there we go. I don't gotta get no juice. I don't gotta get no milk. I can just take it and go. But I take all of these at the same time. The only one that I take that's different is the iron pill, because I take that one twice a day. So I take that one outside of this one. Then another one, like, people always talk about beet juice and beet this and beet that, you know, like, so I'm like, if I can get a hold of the the beets without having to drink beet juice, like people be chucking down beet juice and all that. So I started and I ordered the beet juice. Well, I say beet juice, my bad. Beet juice, the beet root pills, which is the same thing as the juice or whatever. They come in like a capsule, like a capsule. And I take one a day. And, you know, that's another thing where people were talking about, get your levels up, and if you really want to hurry up and get them up or something, just drink some beet juice. So I just started taking these along with my vitamins. So I'll do an update on how my vitamins actually worked for me as far as, like, my levels and everything. Because before I took them, like I said, I got my labs done. So I won't get my labs done again until like 2 weeks before surgery, which is like, I'll probably go like January 1st. No, sorry, it's New Year's. January 2nd will probably be the day that I go and take my labs or whatever. So another thing that I did get was stool softeners. As you guys can see, this box is not open at all. I know people say, oh, vitamins, you get constipated, you can't go to the bathroom, you know, all of this, all that. Like everyone else says, it is different for different people. Me, I've been taking these vitamins for a month, almost a month, and still I haven't had to use these at all, like once. I don't feel, I go to the bath regularly, basically, what I'm trying to say. But, yeah, so I just got it on the safe side because I keep hearing people say, oh, you're going to get constipated and so many vitamins and all that. I haven't yet. Like I said, different strokes for different folks. I'm one of them that probably won't need these right now, but I'll probably need them later, like after surgery or something. So, good to have. So yeah, that's the vitamin stage. Those are the only vitamins I take. Those are the only vitamins I'll be taking after surgery. And then there is Recovery House. So I decided to go with Sea Mermaids. Honestly, I did a lot of research. I really didn't see too much on them. I saw a lot of groups from like Facebook and Instagram. They also have an Instagram page. I saw like reviews from there, but as far as like Google and trying to research them, it was nothing. So I was very skeptical as far as actually booking with them. But then I saw a lot of reviews, and one of, I can't remember her name. If I could, I'll find it in my phone and probably insert it at the bottom. But she was amazing. I mean, like, she just basically won me over. Like, I get a private room with 14 days, or is it, yeah, 14 days, 13 nights, and 5 massages. What else was it? Oh, transportation from the airport and back to the airport and to all doctor's appointments. And my quote for them was only $737. Now they say that, oh yeah, you get what you pay for. Yes, very understandable. But from the reviews, the videos, and everything from off of Instagram, Facebook, DR pages, it was just like, okay, yeah, no, I've seen enough. I really like her. She makes me feel comfortable. She also checks on me still, and I'm not even in the DR, or had surgery yet. She just asked me how my day was. So yeah, that was another plus to me because she wasn't hounding me about putting down a deposit, which the deposit to lock in is $100. She didn't hassle me about it. So I end up putting that down, and I pay the rest when I get there. So that was another thing. So if anybody's looking for a recovery house as of right now, I would say Sea Mermaids, but I will give a full review on that after I've actually had the pleasure of staying with them and seeing how it was. And then there was another girl that actually sold me as far as them too, because she went live and gave a tour of the recovery house. So that was actually a good thing too. And then there is also my nurse. So I was able to get a wonderful, I was able to get a wonderful nurse. Excuse me. Sorry, I told you guys I'm at work. So I'm able to do my videos at work. So, yeah. So I was able to get a wonderful nurse. Her name is Sophie. I will try to insert her. I think it's the best VR. So, no, don't quote me on that. I will look her name up and put it down at the bottom. How I ended up coming into contact with her, she wrote me on Instagram, and she asked me, hey, I'm Sophie. She introduced herself. I'm a nurse. Do you have overnight no shit? I'm like, no. She like, yeah, just go check my page out, and when I go through her page, I asked her for what's at, just in case, because I hadn't found a nurse yet. So yeah. So then she ended up getting my number. She told me, like, I'm asking her, like, so how much is it for, 12 hours? She said $45. Then, for 24 hours, it was $90, which is fine. Most charge $50, so that was already. And then I got to, do my research on her. She has a lot of good reviews. And then she kind of spoke for herself as well. She didn't pressure me on doing a deposit either, just like the recovery house. A lot of nurses that did contact me, they were like, oh, mommy, you got to put down your deposit or the date will be gone. I don't like that. Like, listen, I'm not coming there until January. So I can understand surgeons talking about book the date and all that, but for you to be rushing me and putting down a deposit where I can go right through my surgeon and get a nurse and pay right then and there, like, there's no reason that you should be doing it. Understandable, you might be busy, you might be, you want to book up, but don't ask me to put down a deposit 3 months in advance we haven't talked about anything. So with her, I kind of liked it that, you know, she didn't pressure me on that. For the first week, she actually texts me every day, like through WhatsApp. Oh, how are you doing? How was your night? And she sends tips still to this day. She sends every morning a tip on things to bring, things I should be eating, asking me how I'm doing. Yeah, she basically just showed me. So I'm like, oh, okay, you know what? Yeah, like you showed me to the point where I want you to be my nurse. I know that you're going to take good and very good care of me. And then she does updates all the time on Instagram as far as taking care of her patients and, you know, just making sure she's raising them back to health. And she makes me feel very comfortable with her being my nurse. So I send my deposit. And then on top of that, she only told me to send $20. $20 to her. I end up sending 40. I'm like, listen, lady, that ain't nothing. Let me send you 40, and then I'll just owe you the 50 when I get there. So I end up sending her that, and she has been checking on me every day since the first day I met her. So that was very, yeah, I liked it. That. Thank you. But other than that, I am on the journey to, I don't know. So supplies. I would not be packing a lot of stuff for supplies because I went with Beauty in the Box, their deluxe package. I sent my deposit in. It's everything that I should need in there. And I pay, the box is $280. I end up paying $20 deposit. I pay $260 when she comes and delivers it. She'll deliver it to you at the airport, or she'll deliver it to you at the recovery house. I chose the recovery house because I won't make it to the airport until like 11 something at night. So I just told her I prefer to bring it to the airport the next day. But she was actually very attentive as well. A lot of them are very, very nice. Like, we treat them like they're a third world country or something, but they are very respectful. A lot of them care from what I've seen, and I haven't even been down there yet, and they make me very comfortable. So I think that's it for this video right now. But if you do have any questions, feel free to ask. The next video, since it's getting closer, I will show my before. Give y'all a sense. It won't be at work. You already know that part. But yeah, so I'll show you guys that next video. And then you can like, comment, share, please subscribe, and tell people about it. I know a lot of people want to know about the DR. A lot of people have been doing research like me, and I just want to share my journey and give people some of the knowledge they probably haven't heard. Thank you, Dallas. Be safe. Can't wait to see any of y'all on the snatch side. I can't wait for me to be on the snatch side. So, yeah. See y'all on the flat side, babies.